Right, Daniella, obviously we're going to put the cream on to start with. This will just take the edge off it, obviously not numb it totally, but the product's mixed with lignocaine as well.
Yeah.
So that'll help numb while I'm injecting. What I'm going to do is let this soak in for half an hour. How are you feeling?
Excited.
Good,
Very
good.
excited.
So this is the area obviously where you've got more of a dent and more of a what we call a hip dip here, more than this side. So I'll probably concentrate on this area more here, and then we'll fill this slight hip dip that you've got here. So what we're going to do is put this sterile here, Okay, so what we're actually doing is, remember, we're sort of laying down a foundation with this first treatment. You'll find that you probably won't see much growth on your first one. It's when you have your next treatment that you'll start to see a difference with it, okay?
Brilliant.
And it takes about 6 days to start growing.
Okay.
And then what will happen is at 6 weeks you'll start seeing more growth with it. You can sit on your bottom, where a lot of the other treatments, you know, you can't for quite a few weeks. So with this, you can have the treatment and then so the next day you're back at work. I'd advise you not doing it on the same day because obviously, you know, you've been traumatised and sometimes, you know, your body's saying just have a rest that day. Right, that's one side done. Okay. Right, you ready, honey? Deep breath in. Well done.
I didn't even feel that.
I just think you're totally finished.
Thank you. It wasn't actually painful.
So what I'm going to do is clean these areas down. I want you to keep these areas clean today. Tomorrow you can have a shower.
Yeah.
Just leave it today. No creams or anything on it apart from obviously when you're massaging.
Yeah.
I'm going to use the arnica cream now because if you've got any bruising that's potentially going to come out, that'll help settle it quicker.
Yeah.
So massage wise, what I'm doing is just evening out where I've injected, although it's even where I've put it in. I want it to be nice and smooth when it starts to grow. Obviously I'm just getting it in the place I want it, and what you're doing when you're massaging is actually stimulating that area.
Okay. So even though like I can't see like a drastic difference or anything, I do feel like my jeans are a little snugger, but in the good sense, not snugger as in like I've put on weight, like just around the derriere. Yeah. Photos of my own house. So my dip is improved a little bit, but I've not seen like masses improvement yet, but I was made aware of that first. So I think as long as people don't expect too much from the first one, be aware that it does take obviously more than one to see a full difference, but you will start to notice just little changes within your own little body. I'm actually a lot calmer just because like even though I've had like obviously work done before elsewhere, I'm calmer because I know what it feels like now. So I know that it's not super painful. For me it wasn't anyway. I know everybody's pain threshold is different, but you know, I was expecting that because it was my bum that I'd be like super sensitive to it and stuff like that, and I was quite surprised that I wasn't. So yeah, I'm a lot calmer than I was last time. Oh yeah, everybody knows I've had it done. Some of my mates have been helping me massage it after because it's quite a difficult area to massage on your own. So when I've been at around at my friend's house or whatever, So this is a bit, you know, where you've got a bit of a dip. You've got more of a dip on this side, but we're doing that anyway. Okay, sweetheart, if you remember, you'll get a sharp scratch to begin with, okay? So, deep breath. Well done, you're so good with this. How are you feeling? All right. Okay, you know it'll sting a little bit. Do you feel as though you've seen any difference or nothing yet? I can see a bit of a difference in the dip,
Yeah.
But it weren't like it weren't massive.
Yeah, which is not
but
what we're expecting,
yeah.
because we've got this one and one, maybe 2 more sessions, depending. What we'll do is actually inject the third, leave you 6 months to see whether, how your growth's going.
Yeah.
And if you need another one, yeah?
Yeah.
You've got to commit to this treatment. That's why we suggest gym. That's why we suggest massaging for 5 days. 5 times a day for 5 minutes at a time.
Yeah.
And then to continue with the gym, because each part that you're doing is helping stimulate the areas.
Yeah.
So this one's actually going to sit on top of the one we've already done.
Yeah.
So there's a possibility you'll see more of a result with, you will see more of a result with this one.
It was exactly what I thought it was going to be. Hurt less than last time. Not going to lie, I thought it was going to hurt maybe a bit more, or I don't know what I thought really. I can already tell a difference.
Yeah.
I'm not just being exaggerated.
Well,
here,
where we come.
and I know I've got to wait and I've got to do the whole 6 month thing, but I'm now excited for the third one, and then after the third one I'm going to be excited for if there is a fourth one, and see how we go. And just seeing the progress, Excited, even more than before, because I'm now seeing results, like quite big changes, so I'm really excited. My indentation's finally gone, so it's all all good. Huge, like a huge difference, literally. I was always so insecure about my indentation that I had, and that's now, you can't even see, nobody who hadn't have seen my bottom before would be able to tell that I ever had an indentation there, so I can tell a massive difference. 150%. I tell them to pick this over the BBL. There's no downtime. Literally I'll go do a food shop, crack on. You're not having to recover, you're not having to have an anaesthetic. And everyone who did see my bum in the first instance to now has said that there's a massive difference. So why wouldn't you? Yeah, I walk around naked more at home. Whereas before, even though I've been with my partner a really long time, I wouldn't let him see that I said, that indentation. It really affected my confidence, whereas now I'm not bothered. I've been walking around here all day like this, so
It's going to be nice for your wedding as well, isn't it? Danielle's getting married, and it should still be like this for a wedding as well.
And it's a really low cut back as well, so it'll just sit at the crease of my bum. Didn't really feel any kind of way, just more. It was more like an anticipation to see the results, because after the first one you don't really tend to see much. And I know obviously after speaking with Debbie that it usually is the second and third time that you start to notice changes and stuff, so it was more, I didn't really have any kind of emotion, it was just more anticipation of, I can't wait to see it. And then it was literally, I think, a few weeks, just over a month, that I thought, oh my god, it's worked, it's doing it.
I'm really pleased with Daniella's result, because you'll be able to see from befores and afters that her hip dips are really good. She decided not to go with more in her hips this time. We're concentrating it on this upper area, so she's got more volume and it's pulling up. But the actual dent that Daniella had got there is more of a muscle dent than anything, because when you move in your muscle, you can still see it a little bit, but it was visible straight on. So it's not a defect that you've got, it's just your muscle pulls that little area in more. But I'm really pleased with the second session that's more or less gone. You've just got a little bit there.
I've asked Debbie this time if we can just kind of focus more on the upper part of my bum cheeks, just because now I'm really confident with my dip that I had before. I wanted to get a bit more of a lift, so she recommended that obviously we could do that with the top.